You've taken up medical insurance with Prudential. But when you require hospitalization, do you know how to make the most of your policy? Wonder no more. Our Hospital Alliance Services, or HAS facility, is here to facilitate your medical insurance claims at no additional charge. Let's take a look at what the admission process is all about. There are two types of admission: unplanned or emergency admissions and pre-planned or non-emergency admissions. Emergency admissions are usually for conditions that require immediate medical attention, such as motor vehicle accidents, acute appendicitis, heart attack, and stroke. In emergency situations, go to the nearest clinic or hospital first. At the hospital, you will be attended to by a medical officer at the Accident and Emergency Department, who will evaluate your condition and refer you to a specialist. If admission is recommended, the specialist will complete the pre-authorization form. You may have to undergo medical diagnostic tests such as CT scan, ultrasound, and blood test. At the admission counter, present the following documents for verification, as well as complete the pre-authorization form. You may be required to pay a deposit upon your admission to the hospital. After that, all you have to do is wait for the issuance of the pre-authorization letter, or PAL. What is it? A PAL allows Prudential to pay your hospital bills directly to the hospital. When the pre-authorization letter has been issued, the hospital will proceed with the recommended treatment or surgery. What if the pre-authorization letter is not issued? Don't worry. You may still proceed with admission and treatment, but you will then be required to pay the hospital bills upon discharge. You should then submit a claim to Prudential for reimbursement later. While emergency admissions are common, most medical procedures can be planned ahead. This falls under pre-planned or non-emergency admissions. For this type of admission, you will have to register at the outpatient clinic and present your referral letter if available. You will then be attended to by a specialist at the hospital, and you may have to undergo medical diagnostic tests. If admission is recommended, the specialist will complete the pre-authorization form and schedule a date for admission. Do you know that pre-planned admission also includes daycare admissions for medical procedures that do not require an overnight stay at the hospital? Be sure to ask your doctor if a medical procedure can be done as a daycare procedure. As a pre-admission requirement, please proceed to the admission counter and present the following documents for verification. Then complete the pre-authorization form. Please wait for the issuance of the pre-authorization letter. On the actual date of admission, please return to the hospital. You may be required to pay a deposit upon admission. The hospital will then proceed with a recommended treatment or surgery. We hope that this video has provided you with useful information on the different types of hospital admission processes under the HAS facility. To learn more about this facility, please watch Part 1 of this series. Find out more about our Hospital Alliance services by visiting prudential.com.my.